My name's Leanne. I've spoken to most of you or emailed most of you, and we have some news this week. Unfortunately, Soybe is no longer with the organisation due to a family emergency, medical emergency. And I think I told you that last week that she wasn't available, and it's with much sadness that she cannot continue as your facilitator because her responsibility obviously is with her family and caring for the sick family member. So fortunately, we have another RN trainer and assessor to join us, and her name is Sanjana. I'd like to formally introduce you to Sanjana. And Sanjana is going to be delivering all of these sessions for you, so all of the virtual classes, and then also will be available on Thursdays for the assessment support sessions. But we probably will have a different trainer grading your work and doing the workplace observation. So there will be consistency with Sanjana being the virtual facilitator, and the support will be by a new trainer that we hope to have starting very soon. Welcome, Lara Jane. I just gave some information. I'm recording it. You can watch the recording, but I'm going to hand over to Sanjana now. I'm going to share my screen. When I share my screen, I can't see you all. So if you want to get my attention, you're going to have to unmute yourselves. We do ask for a lot of engagement in these sessions, so please feel free to leave your cameras on and to unmute yourself at any time, and to come in and share any responses to questions that may be raised. So I'm just sharing the screen now. Let me know when you can see that all. And Sanjana, you just let me know when it's time for me to press next.
Okay, great. Thank you. Welcome everybody. My name is Sanjana. I have worked with Meditech, so as a trainer and assessor. So as Leanne said, that like if we're going to have two lots, like I will be delivering the virtual classes, and somebody will be doing your practical part, which is going to be great because we will ensure that make sure that everything is covered, and your assessment task, the written part, we will be handed in, will be we'll make sure that everything is being attended to. So it's going to be great. So today we're going to be doing the HLTP007, and it is the administer and monitor medications. At the moment, you work in HKR where you work alongside the RN, but when it comes to medication monitoring, it is very important that we ensure that we do the right thing, because it's a very important task which you have chosen to do. Okay, so we'll go next. Okay, so before we start the course, this session, we have to acknowledgement of the country in the spirit of reconciliation. Meditech Training College acknowledges the traditional custodians of this country throughout Australia and their connections to the land, sea, and community. We pay our respect to the elders, past, present, and emerging, and extend that respect to all the Aboriginal and Torres Strait Islanders people today. We go next. Okay. So in this presentation, we have got a few objectives, which is very important that at the end of this session, you will be able to confirm delegating health professionals. Um, you'll be like a health professional who will be delegated to authority to proceed with delegation of medications administration according to organization policies, guidelines and protocols, and judgment and jurisdictional legislative, legislative and regulatory requirement. This means that we have to work within your organization. Some organizations might have a different policy, so make sure that you are aware of the policy that is your organization is attending to, and clarify own role and limitations in providing assistance with medications administration with delegating health professional. So when you're working alongside your RN, you will be required to kind of have that knowledge as to how you can work as a professional. Check that all equipment, including those administration aids, which are more like your Webster packs, um, your um, your best med specialists, are complete and ready to use and up to date and tamper free before proceeding. Sometimes the plastic could be broken. We have no idea as to somebody would have added new medications, somebody who would have removed some medications. So like how to check whether the date and the time. It's just like when you buy a packet of cake mix, you make sure it's within the expiry date. It hasn't been tempered by somebody. So it's all about like, these elderly people are going to be taking this medication, so it has to be tamper free as well. Following infection control procedures, very important. Wash your hands before you start medications, and we wash in between each client as well. And confirm medication administration route and procedure. This will be um, on the directive from the pharmacy. It'll tell whether it has to be taken orally, it can be taken just on the skin, or it's an eye drop, or it's an ear drop, because people have made mistakes where they just thought like, oh, okay, this has to be taken orally. There was a client where the nurse said, okay, just go and give this tablet. So they went and they kept on giving the tablet, and the person was trying to take it, and then she comes back and she says, I've given the whole jug of water and he's unable to swallow the tablet. And then the RN says, why? What happened? He said, no, it's a pessary. It's supposed to be given vaginally. So, like, those kind of things are mistakes. It can be like, so make sure that the instructions are very clear when you do things, because some ear drops can be put as eye drops, and that can be very detrimental. So, confirm medications, route and procedures, confirm purpose and function of prescribed medications from clear care plans, and delegating health professional. These are very it is important, but like you might not be able to know, because like as a AIN, you are supposed to know that how many medications the person is supposed to get. But if you do see any allergic reactions, or any maybe the person starts to feel a little bit hot, or they start to have a rash or something, then it is very important to observe all those signs after medication administration, and accurately calculate medication dosage according to authorized document request. This is this is not it is important, but now it has been done by the pharmacy, because they come in the DAA, which is the dosage administration aid, which is very important that like we make sure that it's within the right date, and that the pharmacy is accountable for all, because all the medications that are they are monitored and packed, because what happens, they make sure that everything, like a Monday, Tuesday, Wednesday, what's morning and lunchtime and bedtime and dinner time, it's all it's all packed in a, so you can't make a mistake unless you give double dose or something. Okay. So accurately function and prepare medications according to delegated role, in line with legal requirement, environmental guidelines. Okay, so medications are very important. That's why you can see the medication room is always locked. Okay, it can have a adverse effect on a person who is not supposed to be taking it. So prepare the medications according to delegated role. Okay. Sometimes you must have seen that apron where it says do not disturb, medication round in progress. Okay. Somebody might be asking you for a cup of tea or something. Just say, please ask somebody else. I'm just with the medications, because it's very important that we are keeping an eye on that, because some, I mean, like medications, they look very attractive. They are very colorful. Somebody with dementia might be able to say, "Oh, these are lollies," and they might pop it in. So it's very important that we make sure that like we keep an eye, and we just focus on the task. Okay. Sometimes you could be there could be noise distractions or something. Just focus on the trolley, and who you're giving that medication to. Okay. Um, Lian, could you just scroll it up a bit? Sorry. Okay. A little bit more. Is the next one?
I think it's the next slide.
Yeah, okay, thank you. So confirm delegating health professionals authority to proceed with delegation of medication administration. Okay. So when you are going to graduate from this class, you will have the authority, you will have the certificate where anybody questions will be able to say, yes, Bush knows, like, he's been through the training and he knows now. So it is very important that, like, the person is accountable, because if it was my mother in a nursing home and somebody was giving medications who was not trained and they were not doing the right thing, I wouldn't be very happy without that, because, like, they might be giving the wrong medication. So whenever you need to administer medications, you need to refer to instructions. Okay, these instructions must be confirmed and with authority of delegating health professionals. This is to ensure that they are qualified and trained to delegate and give instructions about medications. Okay, the wrong person would not have the knowledge or skills or to know what to delegate. Okay, so working alongside the RN as a medcom is going to be very important, because you have got a professional, and that's a great thing, especially in aged care. You have got a backup. If you are doing something wrong, you're always about to ask. In the community, it is very important that, like, we do it from the DAA. Okay, here are the ways you can confirm the delegating professional's authority. Check the list of delegated health professionals and their roles and responsibilities. Familiarize yourself with their roles and responsibilities, and familiarize yourself with reporting lines in your organization, with which was chains of a relationship between someone who delegates and who follows the delegation. So that is like, you would know who's your registered nurse. So she's like, the person who's the go-to person in case, uh, and then you work alongside alongside that person. Okay, and refer to documentation. Have we lost the screen?
Sorry, Sanjana, I was just letting
Okay.
There you go. Should be back now.
Perfect. And refer to documentation such as the medication chart. Very important. As registered nurses, sometimes, like, they say, oh yeah, I know that, like, that person has 18 units of insulin, and they don't open the medication chart. You know, maybe the previous day, the doctor had come and reduced the insulin to 12 units. So this registered nurse is so if you are checking an insulin with another registered nurse, make sure that, like, they have their charts with them, so that you can see the current order and the current order that she is checking against, because there could be changes and things like that. It can be very important. And even with your medications, with the ones which you're taking out from your website pack, whether you have the tough books or you have the iPads. So make sure you check, because the iPads cannot be wrong, because it has been linked with the pharmacy and you have the current order in there. So always check against that, like whatever you're giving. Look, medications administration can be quite a task, because it's not only just you popping out pills that you're going to give orally. There could be eye drops, there could be some creams, there could be things like, so one client buy maybe three different routes of medications. So you have got quite a big task. If you are doing 20 people, so you don't want the disturbance to be kind of low. So it's very important that, like, we do the right thing. The next one, please, Leanne. Okay. When confirming the authority of delegating health professionals, you must abide by the organization's requirements. Adherence to these requirements ensures that you perform safe and quality practice. And the requirements are the following: organizational policies, important, very important, organizational guidelines, and organizational protocols, and jurisdictional legislative regulatory requirements. These are quite standard across any aged care, but organizational policies sometimes they differ. Like, it might differ. Like, if you're not too sure, you can always go in and look up, or you can ask the RN, like, what is the policy against this one here? Like, some organizations, they do not prefer the eye drops to be installed in the common area, like in the lounge room. You have to take the person back into the room and do that. So if you know your organization policy, and like the RN says, look, this is what we do in here, that'll be great, because what will happen is that like you are not breaching the policy. And if something does go wrong, they will always support you. Okay. So next, please. So the policies and procedures of any organization is very important. A policy states that the organization's intentions to achieve outcomes, and this will vary in different organizations. These policies and protocols must also provide information on which health professionals has the authority to delegate. Organizational guidelines are not required, but advise employees on how to perform the best practice. Okay, policies do change, and even the guidelines they change. Sometimes bad practice comes in, and then things they had done 10 years ago, it might be changed, and they update. Okay, so legislative and regulatory bodies may set these. However, your organization may also have guidelines that you need to follow on top of the industry and government guidelines. Okay, a lot of the guidelines, insulin, like, if you're checking an insulin with a RN, it's very important that, like, the two people have to be co-signed. You can't just say, oh, it's okay, sister, give it, and I'll come and sign later. No, because you need to eyeball. What if that RN was not in the right frame of mind and she gave the wrong insulin? That means you are going to be dragged into it, because you are the person who's supposed to co-check. So it's very important that you work alongside, and make sure that whatever is the organizational requirement. Next, okay, traditional legislative and regulatory requirements. These are very important, and these are set by the state and the government. Okay, and these are legislative required act involve laws and acts, permits, ordinances, and regulatory policies. Regulatory requirements are part of a legislative requirement. Regulation refers to the legislative policies that help ensure compliance and legislative requirements. Statutory and regulatory bodies create these requirements. In this context, the requirements are established to safeguard the welfare of health consumers. Okay, um, we have got um, we have got the Therapeutic Goods and Administration. Okay, so TGA sets up like what type of things can be sold onto the pharmacies and things. So I mean, like nowadays you can order online or some things which they are not responsible for, but they are having the best interest for people who are, um, for the community. And these acts are set up by the government, and it's set in Canberra. We cannot change it, and it is meant for the best interest, and it has to be really controlled. Okay, because these are regulatory requirements. Next, okay, there are many legislative and regulatory requirements in place. The following are the legislative requirements are Therapeutic Goods Act of 1989, which is the TGA. You might have heard about, like, when the COVID vaccines were coming, and they were saying that oh, the TGA is not approving this one and the TGA is approving this one, or whatever. So it has to go through a stringent um, experiment before it goes and gets out to the people. So that's what the work of the TGA is. The legislative of this varies amongst the states and territories of Australia. Uh, these laws are written to ensure the safety of people as they provide restrictions on the prescription, distribution, and use of drugs and poisons. Okay. Poisons standard February in 2022. This is a legislative instrument made under the Therapeutic Goods Act of 1989, referred to the subchapter of 1.5 of more information and standard. Okay, so if the RN says, can we go and check out a Norsepen or OxyContin, which is the locked, have you seen your RNs having the locked cupboard?
Yes,
Have,
I do.
yeah, have you checked with the RN, like, to
Yes. I have checked with the RN.
Yeah. So now the register is you have to fill your name, your signature, and you have to put your full name and your signature. Before there used to be just two scribbles and that was it. So now it is like, so those ones are very counted. And if um, something gets like if the count is incorrect, if it's more than 2 or 3 tablets missing, it has to be reported to the police. Okay, because what happened, like, in case, what if the previous RN was a drug addict or something, like, having a license and has cleaned that cupboard up. So it's very important that, like, we do the right thing when checking with the medications. So that's the poisons, the therapeutic goods. Okay, next. Okay, so to clarify your own role and limitations in medication administration, okay, as an AIN, you will not be able to administer everything, like, maybe out of bottles and boxes and things. So it's very important to know kind of your role, which is it is a very safe way if you check, like make sure that your the right good, the right time, the right medication, the right person, and all these things has been done because it's prepared by the pharmacy. So which is great. So with your roles, okay, your assessment as support advisors plays a crucial role in assessing the need for medication administration by observing clients' symptoms and consulting with a health professional. In that way, like, you are doing your medication round and you somebody says, I've got a splitting headache, and you can see that there's no Panamex order on her chart, you will report to the registered nurse and say that, like, she's got a headache, because you would have seen a box of PRN medications. It says, like, that those are medications which can only be administered by the registered nurse. Okay, only for a splitting headache, you are not going to call an ambulance to send her to A&E, because, like, it can be fixed on site. So you will delegate it. You will observe the symptoms, and you will report it to your registered nurse. You're not going to go into autopilot and say, I'm just doing the medications. Okay, you've got a splitting headache. That's fine. And just keep on carrying on. Okay, so we just need to kind of observe and see what help we can give. Preparation. They prepare medications according to prescribed dosages and schedule, ensuring accuracy and adherence to protocols. Okay. So if you have your medication chart, if you have your Webster pack, and if you have your client, you are just outside the room, or you can just push the trolley. Like, I mean, like, look, with the COVID and things, we are not supposed to push the trolley inside the room. But making sure that it's the right person, right dose, right time, right, like, so you're doing the right thing. And administration, support workers administer medications orally, topically, or by other approved routes as instructed, maintaining proper documentation. Okay. So making sure that, like, once the person has taken the tablets, then you will sign, and making sure that the whole procedure is been completed. Okay, monitoring they monitor the clients for any adverse reactions or side effects, post medication administration reporting, and any concerns and problem. Maybe somebody has got a new extra pack of antibiotics because they had a bit of a cough the previous day. The doctor came in the evening, and you are doing a morning shift, and you've got a new Webster pack of antibiotics. So you give the first one 8 o'clock dose, and then by 9 o'clock you can feel that there's a bit of a rash, and she's starting to feel itchy and all these things. Obviously, this is a new medication you have started. Straight away, you'll report it to the registered nurse and say, like, like, sometimes the doctors, they people have allergies to antibiotics, but they put it down because they're in a rush or something. So always observe your client, like, with your with if you start a new medication, or if there's any adverse effects to that. Okay, and education support advisors educate clients and their families about medications, regimen, including dosage, frequency, and potential side effects. Okay. Who has seen that the daughter comes and brings the whole box of Panadol and hides it in the top drawer? They do that. Have you seen any in your? Okay. Sometimes they bring and the mother says, "Look, when I have a headache, they take too long to give me a Panamax." And the daughter says, "It's okay. I'll bring some Panamax and I'll put it in here." So always, if there's any medications lying around in their rooms, it has to be collected and it has to put, because maybe she had a headache and the Panadol was only written for only morning and she has a headache at 2 o'clock in the afternoon. Okay, so that means the doctor needs to review her and put her on the regular Panadol so that the headache is not there. So it's very important that, like, we kind of like make sure that, like, if there's no medications floating around, people bring fish oil, people bring vitamin C and all these things. They're all floating around, and it doesn't really they can react with the other medications, so it's very important. Okay, scope of practice. Operate with their scope of practice, which may vary depending on local regulations and organizational policies. Non-medical decision making. Do not make medical decisions beyond your training or expertise. Okay, I'm a registered nurse and I cannot do surgery. I'm not a surgeon. So always work within your scope of practice, such as altering medication dosage or scheduling without proper authorization. Complex medications. Refrain from administering complex medications or procedures that require specialized training or qualifications. Okay, just like the RN gives you a key and says, can you go and give some OxyContin? You are not supposed to be touching that. That like so. It's very important that, like, just work within emergency situations. Do not attempt to manage medical emergencies beyond their training level and seek immediate assistance when needed. Okay, so you work alongside your RN and what should I say? Ethical and legal consideration. Be aware legal and ethical considerations surrounding medication administration, including confidentiality and informed consent. Okay, so it's very important that, like, we keep the confidentiality of the person. Okay, we don't go into the weekend at a barbecue and say that, oh, so and so's daughter, like, she's admitted to the nursing home, and so we just try to keep it very professional. Next, Leanne. Sorry. Okay. Check all medications related equipment before administrating. When preparing for administrating medications, you need to check that the equipment first. These equipments include the Webster pack, the PPE, which is the apron or the gloves, lubricant, measuring cups, spoons, nebulizers, spacers, tablet dividers, and all these things. So that is more like your working trolley. Okay, so it's all about, before proceeding, check that all equipment are complete, ready to use, up to date, tamper free. Okay, it's very important that, like, we have a jug of water or and cups and things. So you are not right at room number 20 and your office, your medication room is at room number 1 and you're running back and forth. So if you prepare everything properly, you know your crusher, your pill crusher, it's very important that, like, everything is on the trolley before we go. The next. Okay. Follow infection control procedures. Okay. Infection control procedures are set and series of actions taken to prevent the transmission of infectious pathogens. Standard precautions are infection control practice you can employ during your day-to-day task. Correct hand washing techniques, gloves usage, infection transmission awareness to prevent cross-infection, example, droplet, bodily fluids, and aerosols. So it's very important to have a little pump pack on your trolley. You might be not having a accessible basin where you can hand wash, so you'll be able to sanitize your hands before you go to the next person. And like, if it's a very infectious area, somebody's gonna cough or something, you know, uh, just try to make sure that, like, the infection control procedure is being followed. Next. How to follow infection control procedures. Here are some tips you might abide by what has been discussed so far. Be familiar with the standard and additional precautions. Does anybody knows what's an additional precaution? what's a standard precaution? Okay, I'll tell you.
Take a guess, maybe.
Yeah,
Standard versus
additional.
additional.
Okay, I'll tell you. Standard precautions is what anybody, even down at the shopping center, next person next to you is supposed to be like infectious. So it's not that like you're saying like you are infectious. It's all about just making sure that you wash your hands before you take the sandwich or whatever. Okay. In nursing homes, when you go from one room to another, you take your gloves off and you wash your hands so you're not spreading. Okay. These are things which you don't, and it is things which are done on a normal basis and without knowing whether the person is infectious or not. Additional precaution is when you know the client has got a hepatitis C, has got MRSA, okay, has got a VRE, which is in the urine. So when you empty the urine catheter, you're going to wash your hand. You're going to make sure that it doesn't splash into your eyes. Things are very important, like, in that way. Somebody has got MRSA, like in the wound, okay, you might like nowadays, like, you have got a shower ensuite attached to the bedroom, so you can shower and then the cleaner comes in and cleans the bathroom. But if you're in a shared room, you might want to shower that person last so that the infection doesn't flow to other people, so it's very important that, like, people who have got hepatitis, HIV, and all these things are additional precaution. That's additional. You might need a gown. You might need a face shield so that you don't get a splash in your eyes, so you don't get a feces or anything that you're doing a bed bath into that. But standard precaution, you don't have to wear the gloves or whatever. Standard precautions, the best form of infection control is washing your hands. You know, it's not about just in the nursing home. It's anywhere for that matter, even at home. Don't you, like, the kids are taught in kindies to make sure you wash your hands. So here are some tips, like be familiar with the standard precautions, educate the client about standard precautions. Like, obviously, like if the person has been fiddling and doing something with the catheter, whatever, and you give them a sandwich, get them to wash their hands. Okay. And know when to apply additional precautions. So, like, if somebody is, I don't know, like in nursing homes, they used to put a butterfly. So, like, it was like a code. Okay, somebody has got an infection, so it has a butterfly, so that people who are young people like you don't want to take the infection home, so you know that to have that extra precaution. Next. Okay, confirm medication administration route and procedures. Okay, the right route is the one of the rights of medications to ensure that each aspect of administrating medication is right. Confirming the route can be done by referring to a document. It's signed by the MO or a qualified professional. Could be the pharmacist, could be the doctor, and they have to write the route. You cannot accept an order and say, like, give Panamax. There are Panamax which can be given anally as well, because people who cannot take it, or they are Panamax, like, in liquid form and their tablet form. So they have to, whether it's orally or it's, so the route is very important, and the right procedure of the route. Okay, so they'll say, like, you can take it like fourth hourly. So if they had it at 8, the next one will be at 12. So making sure that the administration route and procedures are very and administer medications through the wrong route can have a serious and fatal consequences. Okay, so there has been people who have died. There's a dilantin that comes in a liquid form, so and it can be taken orally. And this registered nurse has given it through the IV, and the person just died straight away. So it's very important that, like, just follow everything in there, which is, and you cannot go wrong. Okay. Okay. Next. The following list has information on the routes, the description, and what precautions you need to follow per route. oral, the medication is taken via the client's mouth, chewed or swallowed. Okay, so if it's an oral, it'll be oral. The medication is taken via the ears that are usually eardrops and relieve inflammations and infections. Okay, if you see eardrops, you might see that they are usually given it in the evening before when they go to bed, because then it doesn't drip and it works better. Sublingual or buccal. If the medication is sublingual, it is placed under the tongue, while the medication is buccal. The medication is placed between the gums and the cheek, just in on the sides, okay, and on the tongue. Have you seen any medications like there are some behavior medications that are like a wafer, and they're placed underneath the tongue. And there's medications which is for angina, like a chest pain, they are given underneath the tongue. Okay, so intranasal, the medication is sprayed into the nose. The nasal membranes then absorb this. Our nasal membranes are very thin, like in there, there a lot of network of veins. So when you pump into the nasal, it absorbs the medication. And one of the medications is a good one. It is the one where your nose drips a lot, and they have and it has a good effect to dry up the secretion. Ocular, the medication is taken through the eyes. So eye drops, okay. Eye drops, make sure it's dated, okay. You have a date on it, because um, nowadays in nursing homes they always do a monthly. So on the 30th, the night RN orders all the things, and on the first, the new one comes, and we just date it. So make sure that it's not like few months old. Inhalants, the medication is inhaled via the mouth and breathed into the lungs. Okay, so and nebulizers, this medication is inhaled via the nose and breathed into the lungs. So you would have the Ventolin buffers, and where you put the things, and then it has a sometimes people put a little bit of a tissue so that it doesn't irritate the eyes. Inhalants are you would have seen a spacer when, because usually like when you put a puffer to an elderly person, and you'll say coordinate, like just to, okay, I'm going to give you the puffer now, and they'll go, instead of taking it in, they just blow it out. So when you give it through the spacer, your medicine is not left in the air. It comes into the spacer, and they can take it at the because um happy, like when somebody tries to do things for you, it's very, unless you want to do it at your own pace. Okay, so those are nebulizers. Next. Okay, the primary list has information on the routes, their descriptions, what precautions you need to follow per route. Topical medications and transdermal. The medication is absorbed through the skin. You would have seen when you're showering somebody, you've seen they had a patch on. Not the patch which is for the pain, but these are the patch which is only for 12 hours. Okay, so these patches, the one for the heart, it releases the the medications for the heart, so that the arteries can expand, and he can have a good flow. In the evening, it comes off. Has anyone seen where the RN says, "Is the patch taken off?" So yeah. So what happens? That patch doesn't need to be on the person in the night, because at night the heart is resting. You don't need to. So you need to take it off. Okay. Rectal suppositories. This medication is inserted into the rectum or anus. Okay. Invasive procedures are just check with your policies of your workplace whether you're allowed like invasive. Anything that goes into the body, it might be having a bit of a, whether you need a supervision or with registered nurse. And subcutaneous injection, the injection is inserted into the skin below the epidermis or a dermis, and it could be insulins, it could be like heparins or whatever. So just check with the policy as to how, because where the person is able to, their hands are okay, because they are able to dial the medication and just give it to themselves. that means they are cognitively okay. So you'll be able to kind of give it to the person and they can administer. Vaginal, the medication is inserted into the vagina, which may be solutions, tablets, creams, or a ring. Okay. This sometimes happens maybe weekly. They have a Vegifem or something. So just check with the RN as to how it has to be inserted. So you don't perforate the vagina like things like, and and just to making sure that like it's due. Just let your RN know. Next. Okay, confirm the purpose of prescribed medications. A purpose is the overall objectives of something. A function is the role of something. Okay, the to help you better understand the medication's purpose and function, you should be able to learn the basic pharmacology. Okay, the basic pharmacology is the pharmacotherapy, toxicology, pharmacokinetics, and pharmacodynamics. Now, all these terminology and medications, you will be in your MIMS. You will have a copy in your medication trolley. So if you're not too sure, it's a new medication, you've never seen it before, you've never heard about it, you can open up the MIMS. It has the index, and it will show all the side effects. It will show the what it is for, and all this thing. So it's very important that, like, usually in aged care, people are on medications that have been for a long time. But if it's a new medication and it's new to the market and the doctor has put on and something, you always can have a look into in the MIMS. Okay. Next. Body systems are groups of organs with a similar purpose or function, including with the following: nervous system. It coordinates bodily function, bodily actions, and information from the senses. It is divided into two regions: central nervous system, peripheral nervous system. Okay, just remember CNS and PNS. CNS is all that is in the brain. Peripheral is your sensories. If you touch the fire, if you touch something hot, you straight away it goes to your CNS. Okay, so peripheral is very important because sometimes people who have got diabetes, they lose their peripheral nervous system, and that's when they don't feel any tingling, they don't feel any sensation or something. But central nervous system is like, where it's very important, and where all um, the neurons, they go and they send the signals up to the brain. If somebody has pain, it could be it could be a headache, or it could be a thing where it needs to be um, taken care of. So musculoskeletal system. The muscles in skeleton work together to support and move the body. Otherwise, it would be like a jellyfish. Okay. So we need that framework, a musculoskeletal. And the endocrine system. This system uses hormones to communicate. Okay. Somebody goes on some patches, or they're not, because the hormones are not working as, or maybe it's overworking. Cardiovascular system, the system is made from the heart and blood vessels. Very important. Okay. So we can see that, like, it takes the oxygenated blood, sorry, deoxygenated blood into the heart and gets the oxygenated blood out. Respiratory system, this system is responsible for gas exchange between the body and its environment. Okay. So that's very important that the breathing and the airway is good, because when you see some of the clients who are on puffers, and maybe if they don't have the puffer that shift or that morning, they start to wheeze, they start to have difficulty with breathing. It's very important that we need to. And gastrointestinal system, this system breaks down the food you eat, distribute nutrients, and absorbs nutrients in the body. Okay, very important as well, because the intake is I mean, like, that every month you weigh people in the nursing home. So if the gastrointestinal system is not up to scratch, then the person starts to lose weight. They're not eating as much, or so they need to be looked into by the doctor. Okay, next. Body systems a group of organs with a purpose of function, including the following: the renal and urinary system. This system eliminates waste of the body in the form of urine. Have you seen people with big puffy legs in the nursing home? They are unable to get rid of a lot of the waste, and so that's why. So you might see them. They are on Lasix or water tablets, and it makes them go a lot to get rid of the waste. And then in the evening, like when they're sleeping, the fluid goes down. So it's all about, like, how reproductive system. These are organs and glands involved in producing offspring. Immune system. This system protects your body from germs. Okay, so it's very important that your immune system is quite up. And we know that as we age, it becomes very, very people have get low immunity. When it's cold, when it's winter, they get a chest infection quickly. Remember during COVID, we had to make sure that, like, we don't take the infection because they started to go downhill very quickly. An integumentary system. This is the most extensive, including the skin, the glands, and the skin layers. So this is your whole body of this. The skin is a gland, and this is the most important section because, like in nursing homes, if an elderly has a break in the skin, it is a route for infections to get in, whether it's a sacral, like a wound, a cut, or a skin tear or something. They get the So if you have a nice protective skin and which is supple, that's why, like, always leave a glass of water in front of somebody, because if person cannot get around, they need to really keep the person hydrated, because it adds to a better skin and less infections. So your hand washing techniques and things are very important, like, with this system. And eye, ear, and special senses. The eyes acquire images you see and convert into a signal to the brain and will understand. The ears process sound and communicate this with the brain as well. Other senses include touch, smell, and taste. Nervous acquire information from it that sent a signal to the brain. Okay, with our clients, elderly clients, these um, sensories are very, very diminished. Okay, they can taste the food, but, like, not to the threshold that, like, you and I can do. They can see, but they might have cataracts, they might have glaucoma, they could have macular degeneration. And you and I can just say, like, I can just see it properly. But for them, it's very difficult. They'll need the glasses which are not fogged up and all, like with soup and things. So it's nice and clean. Hearing aids, they might not hear, or they might be able to hear sounds which are not really like. So, like, just put yourself in that, and then, like, making sure that those senses are being looked after so that the person can have um, a proper function of the day. Next. Okay, the following are types of medication groups. Their key aspects and their general effects on body systems and typical disorders you may encounter. Okay, these are different medications which you might encounter. Analgesics. Analgesics are mostly the pain medications like Panamax and things like strong painkillers like your Nurofen and stuff. Okay, it's very important. Prescription drugs, that could be the ones which you only can give with a prescription, like could be your antihypertensives, your blood pressure medication, your diabetes medication, and all things. Opioids are very controlled, and that's when the double lock you have. Okay, opioids can be very addictive as well. That's why, like, they try to manage it in a way so that, like, people are not addicted, but it does control very severe pains, like, morphines and things, like, if you have cancer. Supplements. Supplements are, like, things which you can buy, like um, when Chemist Warehouse has a sale, like, all your vitamins and your minerals and things, and and the cans of ensure like depressants, which are people, if they have any behavior problems, they are depressed, they have moved from their home to nursing home, then they are on this. Stimulants are where people need to be a little bit um, more happy. Like sometimes people who are depressed are supposed to be kind of put on stimulants so that like it makes them better for the day and like they don't feel that the life is not worth living off. Okay, next. Sorry, Leah. Okay, how to confirm the purpose and function of a prescribed medication. Here are the following steps on how to confirm the purpose and function of prescribed medications. Carefully read the appropriate documents. Okay, take note of the medication name. Take note of the purpose and function of the medication from these documents. Check the function of commonly used medications. Refer to the advice of a delegating health professional, consumer medication plan, and reputable websites if you are unfamiliar with the medications. Okay, so there are some websites like you can go into MIMS where you can just get to know about the medication. Clarify any medical jargon with the delegating health professional. Okay, doctors are not supposed to use any jargon. They used to use proper written things. So it has to a better like a person and the next person and the next person. They all get to know about that medication. Never administer medications without fully understanding their purpose and function. Okay, so if you do have your medications on your trolley, um, just kind of like if it's an oral in the Webster pack, when you have time, just go through and just see like what this medication was for, and what is the side effect, and if the person is really having any side effects or whatever. So it's very important. Next, accurately calculate medication doses. Okay, this is done mostly by the pharmacy, but calculating medication doses means medication measuring the medication to be administered according to the authorized documentation that contains details of the medication chart. Undosing or overdosing can either harmful or ineffective. That means you're not giving them enough or you're giving them too much. Okay, so oral, sublingual, and buccal capsules are designed to be solid and are generally not split or crushed. Okay, so with your medication trolley, you will have a little chart. It says do not crush. Okay, so there are some medications which are really in a way that it needs to go inside the stomach and then burst open. Okay, if you crush it, it's going to start reacting from the mouth, that it is meant to be in the stomach. Okay, because it has layers and layers and layers and layers of it. So it's very important that we can familiarize yourself as to what to crush, what not to crush. And calculating for tablets and liquid medications has been discussed in the first of this chapter. Okay, so if it says um, 20 mils of Panadol, don't fill the whole cup. Use the little marker on it and just put 20. Okay, that means you're doing too much. Okay, and you know that Panadol can be. So it's all about like making not giving too less or too in just enough as per the order. Oral, ocular, and intranasal. For drops, instructions may be per drop per mil or mil. For ointments, instructions may mention that you use a fraction of the tube, example, a quarter or half of the tube. There are also instructions of how long the strip of ointment is. Example, 1.2 centimeter of ointment around the eye. Okay, so when you get your medication, make sure there's a label on it. It has the person's name. It has the date it was given by the pharmacy, and it has instructions. Okay, it says, "Oh, okay, apply 2 centimeters to the skin." So you just take the 2 centimeters and then you smear it. Like always wear gloves when you're using ointments and things because that medication can absorb into your skin as well. Okay. So it's very important that, like, everything is applied. So it's just about using it properly. Next, Leanne. Oh, thank you. Administration. Okay. Inhalants and nebulizers. These may be expressed in the number of puffs for metered doses or minutes inhaled. Okay. So they will say give 2 puffs. The rectal, suppository, vaginal. For enema or an enema is a device used to release fluid into the lower bowels. For capsules, tablets, same as above. Okay, so mostly like this enema is used in community, but in nursing homes, like, you would have said, like, if you now do a morning shift and they said, oh, the night nurse gave an enema, gave a suppository, so we have to sit him on the toilet. So it's also all about making sure that what's been inserted. Subcutaneous injections. Note that this is to be self-administered. Okay, as I was saying, get them to dial it themselves. You prepare everything. You are there to stand, get them to dial the medication and give it to themselves. Okay. If you are measuring using a syringe, line up the black line of the plunger with the desired dose. Okay. So when we use a syringe, there is a little bung on top where the syringe is. So you always use the line which is really on the top. Okay. Epinephrine and insulin pens typically have dials you can twist to measure the correct dose. Okay, so these ones are EpiPens, like when you do first aid and things like that, like people who have allergic reactions, they are they can dial and they can give it to themselves. Okay, topical medications, which is and transdermal, these may be expressed per patch while using patches. Lotions, creams, and ointments may be expressed as fingertip units. Okay, sometimes they say put the gloves on, put fingertip, and just put it on the thing. Some ointments are cytotoxic, so your registered nurse will be able to tell you as to which one is to be used with precaution. Okay. We'll go next. Okay. Prepare medications according to delegated roles. Okay. Organizational requirements include the following. Doing tasks within the role responsibilities. This would involve following the delegated health professional's instructions. Legal requirement. These stipulate that support workers uphold the client's rights, which must which must always be respected regardless of the medication's administration stage. Okay. Environmental guidelines. These are implemented to ensure that infection control procedures are applied to maintain a clean and sanitary environment. So we're making sure that they're not sitting on the toilet and we're just pushing the medication in their mouth. Okay. Prepare medications according to delegated roles. Have you done this one? Doing tasks with it. This would involve. We're going backwards. Yeah.
Sorry, Sanjana. I was just having some technical issues there in the background. So I think, yeah, have you done this slide? I think you've done this slide.
Yes.
So yeah, you're up to the case study there.
The case study, yep.
Yeah.
Okay. I'll get someone else to read the case study. Pooch,
yeah, what I'm going to do, what about if I do a bit of a summary? So if we look at this is talking about Sarah. If I might have to minimize that one. Sarah's a support worker. She's responsible for assisting clients with medication. So the way we'd laid this out is that element 1 was about confirming the delegating health professional's authority to proceed. So Sarah does this by beginning the day by reviewing the organisational policies, procedures and protocol, and she ensures that she has received proper authorisation and training from the delegating health professional. So who would be the delegating health professional in the Columbia aged care home? If anyone wants to come in and have a crack at that, who would be your delegating officer?
The RN?
RNs? Anyone else? That's correct, isn't it, Sanjana?
Yes, that's very correct. And it could be a clinical coordinator or somebody who is got a registration. Yeah.
Yeah. Okay, lovely. And Sarah understands her role as a support worker and the limitations. She knows she can only assist with medication under the supervision of a qualified health professional. So that's the situation that you guys are in now because you don't have the certificate administer and monitor medications. Yeah. So you must understand your job description and the scope of your own role.
Yep. So
Yeah.
it is very important that you work like next to the RN registered nurse because you cannot be doing it on your own and without the certificate. So
Correct.
if something goes wrong, you'll be in the court of law. You won't be supported.
Legal. That's correct. That's correct. Before administering any medication, Sarah meticulously checks all equipment, including the dose administration aids, to ensure they are complete, in working order, and free from tampering. So why is this important? Would anyone like to let us know why is it important to check all the equipment?
To check if it's properly working.
Yes. It's functional. Hasn't been tampered with.
Exactly. And like as I was saying, you have your trolley ready with everything, like that is all clean, and you have loaded the trolley with your cups, your water, your crusher, your pill, and all your medications that are not tampered with, so that like you're not running to and fro.
Yeah, lovely. And Sarah follows the correct infection control procedures. I think Sanjana has laid them out quite clearly and quite well in today's presentation. Sarah double checks the client's case care plan and consults with the delegating health professional to confirm the correct medication administration route and procedure for each client. She understands the importance of adhering to prescribed protocols. So what does that actually look like in an aged care home, Sanjana?
That looks like as if like she's doing the right thing. She's making sure that she's working in a scope of practice. She's referring to the registered nurse in case she's not too sure of anything. She's using the infection control, which is like we're washing your hands and making sure that like you're not cross contamination. And she has done in a way like she's making sure that she's watching the care plan and the medication chart like if she's not sure as to the route and things. So which is great.
Very good. And so the next one, I think Sanjana gave some examples of this. Before administering any medication, Sarah verifies the purpose and function. Now, why is this important? To understand the rationale behind each medication that you're giving out. What can go wrong if you don't?
Owen, tell me.
Come on. Why is it important?
Side effects, to know the side effects, the adverse.
Good. Thank you, Butch. Yes. Side effects. You don't want to be giving it in the wrong route because it can be fatal, can't it?
Yeah.
Yeah.
And you can monitor the effectiveness that it has worked, like if it's a swelling, like you've given her the Lasix tablets, you can see the swelling that has gone down, or like, and then you can report to the registered nurse that whether it's effective, it's working, or it's not working.
Mm-hmm. And thank you for that. And then Sarah carefully calculates medication dosages and thoroughly checks the authorised documentation requests, considering things such as weight, age, and medical history. Okay, but the reason to do that is to prevent medication errors. Is anyone concerned about being able to understand the calculation and the dosages? You feel comfortable being able to interpret this on medication that you've seen in the aged care facility?
What happens is that like with the medication dosages and things like that, if you have your medication chart, which is very current, you will see the date, you will have your medications, you will never go wrong. Okay. Because if you follow the order and if you follow the person and the person is the right person, you can never go wrong. And those are the 5 rights that we have.
Yeah, very good. I think that sums it up. Also, she obviously follows legal and legal and environmental guidelines. She's aware of her policies and procedures, and you're aware of this. You're working within the scope of your role. So, right here, right now, are you able to administer medication in your job role, Winnie? Are you allowed to administer medication?
No.
No, that's right. Not until you have finished this course. That's right. And even then, there's restrictions based on policies and procedures and the protocols within your organisation. Sanjana, I'm going to have to just move a little bit quickly through the end of this because I've got another meeting coming up. But thank you so much for a very informative presentation covering our learning objectives, which you can see there up on the screen. And all of those are quite important when it comes time to do your assessment. But it was obvious about that you shared your experience, and it's obviously you've got lots of experience in this space, Sanjana, and we're very lucky to have you. So thank you for stepping up and doing these virtual classes for Meditech Training College. Your expertise is very much appreciated. I'll be sending everybody the call to action, what you are meant to be doing next. So by now, last week's homework was that you had to do Chapter 2 e-learning module, and you had to answer knowledge questions 1 to 10. Now, this week, we're presuming that's already done. You now need to do e-learning modules 3 and 4, and now you can attack the knowledge questions 11 to 20. And that means that by this time next week, Sanjana will be here again next week, you will have completed up to e-learning modules 3 and 4 and the first 20 questions of the knowledge questions. It's very important that everybody is maintaining that momentum because the next part of the assessments will not be able to be completed until everybody has completed their assessment. So you don't want to be the one person leaving everyone behind. So please, keep to the schedule of completing all of these homework action items that we're setting for you, because that means that you will avoid any stress, any last minute panic to get everything done. So who's going to put their hand up? I'll stop recording and then you can tell me the truth. How many people